Client is experienced a CVA 10 hours ago. Okay, 10 hours ago CVA. Oh crap, this is medication. Oh my goodness, I need my pencil. Receiving heparin protocol activated partial APTT 65 seconds. All right. I don't know the formula for this. Is it therapeutic? Is anybody else on that question? Protamine sulfate. What is that? I don't even think that's in a book. I thought this was med-surg. Why it look like pharmacology? Am I in the right exam? All right. 65 seconds. Ooh, that sounds long. He's probably gonna bleed to death. All right, so he's gonna bleed to death because 65 seconds is too much. I'm just gonna call the doctor because this guy's about to bleed to death. Yep, call the provider, right? Yeah, call for help. Yep, definitely call a friend. Call the provider. A nurse has completed an informed consent with a client. I've changed my mind and do not want to to have the procedure done. Which of the following actions should the nurse take? If he doesn't want to do the surgery, then we got to cancel it. We can't force the patient, right? Or can we? Informed consent is legally binding. He could have forgotten. Nurse is caring for a client who came to oh my goodness, I'm so tired. To the emergency department with abdominal distension and is now on the medical surgical. Finally, we're doing med-surg unit with an NG tube in place to low gastric suction. This should be low intermittent. Okay, so I'm looking for a right answer that says put it on low intermittent. Client is reporting anxiety, discomfort, and a feeling of bloating. Which of the following actions is a nurse's priority? Turn it on intermittent. Oh, we could definitely give him, he's anxious, so we could give him anxiety medication. All right, so that's probably what it is. Yeah, I would take it out because it's not working. Take the tube out and put it back in. Yep, that's it.
How did you feel about our little skit just now? How did you feel about our students in their exam? Did you see yourself? Did you recognize anyone you know? Or did you see some things that made you really concerned during this test? Let's talk about our questions and whether or not we identified some areas where or keys for unlocking your mindset, your RN mindset, might have been more useful to our students during this test. All right, so let's start off with a question about the CVA. How about your patient having a CVA 10 hours ago? And we have a APTT level of 65 seconds. We wanted to make a decision about what was a priority action for our nurse in this case. What are the things that were important? I say we need to appreciate key number 1, time management and prioritization specifically. Key 2, respecting our resources. So knowing what the resources say or the content says, nursing content says about this kind of information. And key number 4, what is your clinical reasoning? How are you going to critically think to decide what is the priority action in this case? So first off, you had to know a little bit about a heparin protocol, whether you know the evidence related to heparin protocols and what's normal and what's not normal. Is 65 seconds normal or is it? So if we know that, we know that 65 seconds is normal and what is part of our actual therapeutic goal. So we could easily eliminate number 1, call the provider immediately. Do you think there is a need to call the provider immediately? When would you call the provider immediately? If you are the RN with the scope of the RN where you have some autonomy over your practice, do you need to call the provider when your patient's APTT is in normal range during heparin protocol? I don't think so. We don't need to call the provider. We can autonomously continue the treatment that has been prescribed. Administer protamine sulfate. Do you know what protamine sulfate is? Again, we have to go back to key number 2. Do you know your content? Do you understand and respect what the evidence says? Do you know what protamine sulfate is? I know what it is. You know what it is by now, hopefully. Protamine sulfate is your antidote for heparin therapy. When would you use an antidote? When your heparin has gone beyond its therapeutic range and has now ventured into more dangerous grounds, and you want to reverse the effects that it is having. Is that the case in this scenario? No. Do you want to continue the infusion at this time, at the current rate? Absolutely. Why? Because whatever you've been doing with this heparin protocol is actually meeting goal. So your action would be to continue the therapy. Let's look at our question about the informed consent. So here's our patient who is scheduled for surgery, agreed to surgery, has an informed consent signed, and now states, I have changed my mind. I don't want to do the procedure anymore. What action should the nurse take? Our students in this exam were on the right track. They utilized portions of unlock key number 2 by deciding that indeed the informed consent is a legally binding document. But does this mean that the client does not have the right to change his or her mind? Absolutely not. A legally binding document does legally bind you until that document is either rescinded or otherwise altered under these same legal guidelines. Reminding the client of this might be useful, but is there a better answer? Do we want to call the provider? Should we notify the surgeon that the client wishes to withdraw his informed consent? Would this be a therapeutic response? We're looking at unlock keys number 2 and unlock keys number 4, where we're trusting the evidence about legally binding informed consents, and we're also looking at our ability to clinically reason. So do we want to notify the surgeon? I think it would be important for the surgeon to know that there is a change in the patient's status or in the patient's decision. How about informing the surgical team that they should cancel the client's surgery? Does the nurse have that scope to cancel a surgery that he or she did not schedule? And then how about option number 4? Proceed with the preparation of the patient for the surgical procedure. What does that mean? It essentially means ignore the patient's decision to change their mind and just go ahead and continue with the process. Does that appreciate the patient's rights and legal advocacy? No, it doesn't. So our answer that we're left with is then to first notify the surgeon that the client has withdrawn their consent and no longer wants to do the procedure. That is now a new conversation for the procedure for the client to have with their provider rather than with their nurse. How about our question about the patient with abdominal distension who comes to the emergency room? I think here we're using our unlock keys number 2, number 3, and number 4. We're trusting the evidence, whether we learned it in our textbooks, heard it in a lecture series, or we've experienced it or witnessed it in a clinical setting. The other thing we're doing is we're respecting the nursing process, and we're using all that to adopt a clinical reasoning approach. Here our patient is now on the medical surgical floor. They have an NG tube that is placed on low gastric suction. The understanding is this low gastric suction would be intermittent because that is what is prescribed typically with the use of an NG tube. Be careful that you are respecting and trusting the evidence in the textbook. So it is important that you know that it ought to be low intermittent suction, but don't go looking for that one right answer, because if it's not there, then you get stuck. So the patient now is presenting some assessment information. They're reporting anxiety, discomfort, and feeling bloated. Based on these cues or this assessment data, the nurse would determine what the problem is. As the nurse is looking at these cues, there could be a number of potential causes of the problem, but what is clear is that the patient is clearly obstructed on some level. So which of the following actions is a nurse's priority, right? What is the purpose of this low gastric suction? Is it functioning? That should lead you to a correct answer that says, check to see if this suction equipment is actually working. Because if this suction equipment was doing what it ought to do, then the patient should not be bloated, because suctioning would relieve that. The patient should not be in discomfort, because suction would relieve that. And the patient would not be reporting this level of anxiety. So it is possible that the problem is with the suction. So we're looking for an answer that says either, like you were thinking, that it's not intermittent, or it's not set to the right settings, or perhaps that the tube is displaced. Requesting a prescription for medication to ease the client's anxiety isn't really helpful, because it's only going to address one symptom and one part of the problem that the patient has expressed. So we can eliminate that. Irrigating the NG tube with 100 ml of sterile water, what does the evidence say that this would do? So in other words, what do I want to do? Irrigate the NG tube. That's an intervention, but what is the rationale? If you don't have a rationale when you ask yourself, then it's probably not the right answer. That's your nursing process, and you have to respect it. So here we are, we're looking at option number 3, which is to check to see if the suction equipment is working. That's an assessment. Would you want to know if the suction equipment is working? If you're appreciating your nursing process, then you know the first thing the nurse ought to do when given the option that says prioritize is to recognize whether you have enough information to define a problem. Right now we have a lot of information, but it has not clearly defined a problem. So let's check the suction. But just for certainty, let's check what option number 4 says. Option number 4 says remove and then reinsert the NG tube. So that's another intervention. It's telling you to do something. Are you ready to do something? Can you do something? Is it safe to do something if you don't know which problem you're trying to solve? So how about going out and getting more information before we start doing things? So your answer here is to actually check to see if the problem is being caused by your suction equipment. Once we know that, then we know what to do. We may not have to remove a tube. We may just have to adjust our suction. Okay? So your answer is option 3, based on our nursing process. If you trust your evidence and adopt a clinical reasoning approach, you will know that we are right now still in the assessment phase of our nursing process. So hopefully you've been able to appreciate our keys for unlocking your mindset. I hope I've been able to help you get to the point where you are ready to change your mindset if you haven't already. It's going to be a wonderful journey into being the RN. I hope that we've been able to help you with changing your mindset.